Es que no hay nadie. Hello everyone, this is Dr. Rodriguez. How are you? Hello Maria, hello Brady, how are you? Feel free to ask anything, okay? We're gonna be here 30 minutes, so feel free to ask. Everything is okay, Maria. What about you? I have a question for you. Are you already a patient or are you interested in weight loss surgery? Today we're gonna do a question and answer webinar, so I will be here for the questions. So I qualify for the surgery, but I'm not huge. I'm 5'10" and 250. I'm worried about losing too much weight. Is that even possible? Okay, we need to do the BMI. But if your BMI is higher than 30, we can do a surgery. We recommend start with the gastric sleeve. If you don't have acid reflux, the gastric sleeve could be a good option for you, Brady. Everybody asks about how many pounds can I lose with the weight loss surgery. So everybody's different. Weight loss is different in every patient, but for sure, all the patients are gonna lose weight. The first 3 months, patients can lose to 20 to 40 pounds. After that, every month, probably they're gonna lose like 10 pounds. And probably after 1 year, everybody has a plateau. But we can control the weight loss with the diet, the post-op diet. But if your BMI is higher than 30, you can be a candidate for a weight loss surgery, Brady. Maria Tanner, why is that what is it that I can eat some days more with my gastric sleeve than other days? It will depends of the diet, Maria. The quality and the consistency of the diet is really, really important. The quality, if you do high carbs diet, for sure you're gonna be, your body's gonna ask you for more diet with carbs. So something important is to understand what are you eating and the quantity. Remember that with the gastric sleeve, you can stretch your stomach again, so the quantity of the food is gonna be something important. Quality and quantity is something really important after surgery. And what is your current BMI, Maria? So you had a gastric sleeve in 2023, but tell me, how was the weight loss road with you? Hello, Trish. We're gonna be waiting for you. How are you? Where are you from? Maria is asking about exercise. After weight loss surgery, you can do cardio, but what we recommend is weightlifting, because when we do weightlifting after weight loss surgery, all the hormone change can help you to grow your muscle. And after weight loss, sometimes the muscle can go down. So lifting is something really important and something we recommend. If you do cardio, you can lose more weight or faster, but we need to think about the muscle. So lifting like a bodybuilder is gonna be the best options. So Brady says she has acid reflux with certain foods, spicy foods. Well, patients with, if we do gastric sleeve, we need to check if patient has a hiatal hernia. If you have a hiatal hernia, we can fix it and we're gonna improve the acid reflux. But all patients must know that after a gastric sleeve, patients can have acid reflux about 50 to 20%. So sometimes when the acid reflux is really, really hard, we recommend to do a gastric bypass. Obviously, with the bypass is a more powerful tool. So I recommend to check if you do not do those foods, as the acid reflux improves. If you don't have acid reflux with all the elements or with all the food, probably we can do a gastric sleeve to check if you have a hiatal hernia. We fix it and we can do a gastric sleeve. So Trish is from Louisiana. We're gonna be waiting for you, Trish. Yo me quiero hacer un bypass con ustedes. Hola, Zulema. Claro que sí, aquí estamos para servirte para hacer el gastric bypass. Si tienes alguna duda, con mucho gusto vamos a resolverla. Todas las dudas que tengas del bypass las puedes hacer ahorita con confianza. So, hi, doctor. Does taking anastrozole affect the weight loss? Yes, Isabel. Anastrozole can affect the weight loss, but with the weight loss surgery, the weight loss is going to be much better without the surgery, because in the weight loss surgery is a metabolic surgery, and anastrozole works in hormone cycles, and with the weight loss surgery we can change all the hormone cycles. So the weight loss surgery can help you a lot, even if you are taking anastrozole. Why are you taking anastrozole, Isabel? Hello, Shannon. Penny, I'm scheduled for February 3rd. I'm 57 years old. Well, everybody's different, but you're not too old, so probably you're gonna have a good recovery, Penny. Everybody's different, but for sure you're gonna have the same recovery, because we do the surgery with laparoscopic technique. We do only little incisions, so recovery is gonna be almost the same, but everybody's different, so it depends of each patient. Where did you go to school for bariatric surgery, Maria Tania? Well, I did weight loss surgery in Torreon, Coahuila. There are my masters, my teachers, my mentors in weight loss surgery. Then I come back to Tijuana, and right now I'm part of right now I am a mentor of bariatric surgery. I'm part of the college of the National College and the local college of weight loss surgeon. So, but I did my bariatric surgery school in Torreon, Coahuila. What is the full recovery time? The first 5 days are the first step of the recovery, but after 2 weeks, you're gonna be like 90% of recovery. After 3 weeks, probably you're gonna be about 95, sometimes 100% of recovery. Everybody's different, but probably about 3 weeks in total. I had surgery for breast cancer this past May. Okay, Isabel. Do you had a gastric sleeve or gastric bypass, Isabel? Penny Jones is coming next Friday. We're gonna be waiting for you, Penny. Shirley, let me check your questions. So if we have a hernia, do we have to pay more, and how much for the surgery? Right now, yes, you need to pay more because we need to add another surgery. But we can send you all the prices. All the prices are in our web page, but we can send it to you, okay? But it has an extra fee. Okay, Isabel has a sleep. Anastrozole is going to work perfectly with the gastric sleep. Sometimes when we do gastric bypass or duodenal switch, some medications can be affected, cannot be absorbed in totally, but with the gastric sleeve, you will have no problems with the anastrozole. Do you recommend removing the gallbladder? If it is necessary, yes. If you have gallstones, we recommend to do gallbladder removal surgery, but because the 10 or 15% of patients with obesity can do gallstones. So if you have gallstones, it's gonna be better if we remove the gallbladder during surgery because it's gonna be the same anesthesia, only 20 more minutes. So it's a safety procedure. So yes, I recommend to remove gallbladder. What are your thoughts on Ozempic? Well, this is an interesting topic, but I know it works, but we're having a lot of patients after 6 months doing Ozempic are having a lot of gastrointestinal issues, gastric pain, constipation, and also they have regained. So at this moment, we are doing a lot of weight loss surgery in patients that are chronic taking Ozempic. So probably we're gonna see more patients like this in the future. Wanda, almost on my. Oh, how are you, Wanda? How do you feel? Nice to talk with you. Congratulations, Wanda. So we did a gastric sleeve, gastric bypass, or duodenal switch, Wanda? Maria, what are your favorite surgeries to perform? Well, I like to do what the patient needs because BMI between lower than 40, probably the gastric sleeve is gonna be a good option. If patient have acid reflux, probably the gastric bypass is gonna be the best option. When patient has a BMI about around 50, the gastric bypass is gonna be the best option. When the patient has BMI higher than 60, duodenal switch definitely is going to be the best option. So I like to do all the surgeries, and every patient is different, so we need to give what the patient needs. Oh, I'm really happy you're riding your horses, Wanda. Congratulations. Oh, we did a sleep. Congratulations. Isabel Vargas. I'm having trouble losing more than 35. I was wondering, but because I started taking an anastrozole after surgery, should I take tamoxifen seed? Well, all those recommendations about cancer, breast cancer medication, you need to talk with your oncologist. We cannot change that because I am not expert on that. But what I can tell you is that after a gastric sleeve, anastrozole and tamoxifen doesn't have a lot of change, okay? Because absorption is going to be the same. So probably that question is more for your oncologist because they are expert in or they can do that recommendation about changing or switching a medication about cancer. Robin, I had a gastric bypass 1 year ago and I took my weight down to where I like, but I'm finding I'm starting to put a few pounds. I'm craving junk sugar. Okay. Hello, Robin. After the gastric bypass, if you do carbs, you must be careful about to have symptoms of hypoglycemia. Okay. Probably you need to check about your sugar levels. Sometimes that's called dumping syndrome. So probably we need to start with that, and we need to go back to the diet, because if you are having cravings with the sugar, that is something common. You need to go back to be really disciplined with your diet. Do you have a recommendation on chewable bariatric vitamins? Yes, the first 3 months after weight loss surgery, I recommend to do chewable because it's going to be easier for you. But after 3 months, you can use capsules, you can do pills, because chewable are probably more expensive. But in the first 3 months, I recommend to do chewable bariatric vitamins because it's going to be easier in the new stomachs. The new stomach size. So yes, I recommend that, but probably only in the first 3 months. If you want to continue with the chewable, it's okay, but probably it's not necessary because quality is the same. Do you recommend a brand? Yes, we have a brand that we recommend here in Mexico Bariatric Center. We're going to give you all the information also in our web page. We're going to give you all that information. Okay, Wanda? Trish, sorry. I'll remind people to watch the meds after losing. Yes. After weight loss, all the blood pressure medication is going to change because probably you're not gonna need it after probably 2 months after surgery. You're not gonna need the same dose, so you need to go to your doctor and check the blood pressure, because probably you're going to change the doses and probably stop that medication. Okay, let me go back to check the questions. Maria, when it is okay to start breastfeeding again after my surgery? Okay, we're gonna use antibiotics after surgery, so probably 1 month after surgery, you can go back to the breastfeeding. So probably 1 month is going to be a good time. Dice SIDA. Hola a todos, mi nombre es Fanny Morales. Padezco de enfermedad que me ha condenado a la muerte, cáncer de garganta. Okay. My girlfriend is BMI is 30. With 30, we can do a gastric sleeve without a problem. How long after having the sleeve can I come off of the CPAP? Okay. The exactly number, it will depend. You need to do again the sleep apnea test, but probably after 2 months, you can do that test again. For sure, you're not gonna need the CPAP machine, because that is something that all the patients with the weight loss do not need the CPAP machine anymore. Probably after 2 months, you can check again with your doctor, but for sure it's gonna be something around that day. How many surgeries do you schedule per day? I feel comfortable with 3. Sometimes we do 4, but normally we are around 3 or 4. Robin, she says that I have an autoimmune problem and many tests, but cannot figure out. Has been tracking. And many tests, but cannot figure out. Has been attacking liver. Can this bypass related? I don't think so, Robin, because we reroute in the bypass. We reroute the small bowel, but we not probably it's not related with the autoimmune disease, Robin. The weight loss surgery. How much pain do patients experience after surgery? Well, it's not a painful surgery. Probably it's a pressure pain that is a little bit different, because we use a medical gas to inflate your abdominal cavity. After surgery, we try to remove as much as we can, but probably it's gonna be there about the 10% of the gas that we use. So that gas, you're gonna feel like pressure. If you walk after surgery, you can release out that gas, and the pain is gonna improve a lot. So, but it's not a painful surgery because we do a small incision, so it's not a painful. Probably from 1 to 10, it's about 3 or 4. Maria Tanner, why I'm always cold after weight? This is a common question, because the fat controls the temperature cycle, hormone cycles in your body, and you need more time to your body understand your new weight. So that is something that always happens, because your body needs to understand the new weight that you have. Awesome. I can't wait to stop using yes, you're gonna stop using your CPAP, Summer. Will I be able to take my medication after surgery? Yes. You're gonna be able to take it. Probably you need to crush it the first 2 weeks, but yes, you're gonna be able to start medication the next day surgery. How long is the surgery for sleep? It could be 45 minutes to 1 hour. Summer, you will be my surgeon. Oh, thank you for trust in me, Summer. I'm close to 400 pounds and scheduled for NY on March. Okay, how much weight can I expect to lose in 3 months, 6 months? Okay, probably in the first 3 months we can go near to in 3 months around 60 to 80 pounds. After 6 months we can go something near to 120, and after 1 year probably we can go something near to 180. How many incisions? We start with 4 incisions. Sometimes we can do it with 3 incisions if the liver is small, and when the liver is big we need to do 5 incisions. Yes, the gas X strips and the heating pad helps a lot, yes. My thyroid medication is capsule. Will I be able to? Yes, you're going to be able to take it, Bobby, without problem. Don't stop it. Don't stop it. No. Thyroid is not necessary to stop the medication. Okay, everyone. I need to say goodbye because the webinar is finished. But if you have more questions, we can do it again. Okay? Thank you so much. ¿Dónde? Okay. And also, an announcement is we're gonna have a webinar this Saturday at 10 a.m. Okay? And everybody is invited. So I hope to see you there. Bye-bye.